Now let's talk about what causes the primary myelofibrosis. As it is a primary disorder, so most commonly the primary disorders are generally the ones which have some genetic predisposition or which are caused by some abnormal mutations or certain receptor abnormalities. As we saw in other types of myeloproliferative disorders like the polycythemia vera and the essential thrombocytosis, the major players are the JAK-STAT tyrosine kinase receptors. These are the ones in the mutations in which cause primary disorders. So similarly, the etiology of primary myelofibrosis, it is also multifactorial. There are certain rare non-random chromosomal abnormalities, just like as we saw in CML, in which there is a BCR-ABL mutation or the 922 translocation. Certain rare non-random chromosome abnormalities can lead to the primary disease which causes myelofibrosis, but this is majorly a rare process. The important etiological processes that cause this primary disorder are the mutations in the thrombopoietin receptors or the TPO receptors. As we know that these are the receptors for the growth factors like the TPO or the various types of interleukins. So about 50% of the primary myelofibrosis is caused by either the mutation in the thrombopoietin receptor or mutation in the calreticulin gene, the CALR gene. Calreticulin performs various types of functions in the cell. The exact mechanism is not understood yet, but these mutations in the thrombopoietin receptor and the calreticulin gene account for about half of the cases of myelofibrosis. The other half of the cases that are attributed are to the JAK2 mutation. JAK2 mutation was very evident also in the essential thrombocytosis or the polycythemia vera. So JAK2 mutation, the thrombopoietin receptor and the calreticulin gene, these are basically the common mechanisms which cause all type of myeloproliferative disorders. If there is a mutation that causes these genes, as we know that JAK2 is a tyrosine kinase receptor. So if it is activated without basically a receptor ligand interaction, or if it is activated on its own, then it causes uncontrolled differentiation of the cell and it leads to production of a large number of cell population. We're going to talk more about it in the pathogenesis section. These are the etiological causes of primary myelofibrosis. Now let's quickly go through what can be the causes that can cause a myelofibrosis as a secondary disorder. A lot of diseases can lead to myelofibrosis, or the basically myelofibrosis signifies the spent phase of the fibrosis. It can be a reactionary process to certain types of hematological disorders or the non-hematological disorders. A lot of malignancies cause myelofibrosis. So when these malignancies have been there for a long period of time, then the bone marrow enters a fibrotic phase eventually, or you can say that is basically the end of the bone marrow functioning, and the bone marrow can no longer perform on its own, and we either have to replace the bone marrow by a bone marrow transplantation, or we have to symptomatically manage the patient. So what are certain types of secondary disorders which can lead to myelofibrosis? A large number of malignancies can cause, the common ones being certain types of acute leukemias like the AML or the CML, which is basically a Lilly disease. CML can lead to myelofibrosis, or myelofibrosis can also lead to leukemias. Around 10% of the patients that have developed myelofibrosis, if they go on to live for a long time, they can develop leukemia. So it is interchangeable. Either the leukemias can secondarily cause myelofibrosis, or myelofibrosis as a primary disorder can also lead to the leukemias in a long-term way. Similarly, certain rare types of disorders can also lead to myelofibrosis, like the hairy cell leukemia or the Hodgkin's disease. Primary myelofibrosis is itself a different etiology. Multiple myeloma, which is basically a malignancy of the plasma cells, it can also cause myelofibrosis in the long run because there is a lot of fibrosis going on, amylin deposition in this disease. Along with that, certain types of myelodysplasias, which we talked about in our previous lectures, they can cause myelofibrosis long term. When the myelofibrosis is secondary to a malignant process, it is generally called a myelophthisis or the myelophthistic process. Primary myelofibrosis is the term, or myelofibrosis with myeloid metaplasia is the term generally used for primary myelofibrosis. So if you see myelophthisis, the term being used somewhere in some literature, then you should be aware that it basically signifies the secondary myelofibrosis. Similarly, certain types of metastatic carcinomas, like the renal cell carcinoma or any carcinoma that goes to the bones or the bone marrow, can lead to this process. Polycythemia vera, it is another myeloproliferative disorder, and all of these are basically interchangeable. Polycythemia vera can transform into myelofibrosis, and similarly, essential thrombocytosis can also transform into the myelofibrosis. And when it is when it is a secondary process to these type of myeloproliferative disorders, we term it as a secondary myelofibrosis. Certain types of rare systemic mastocytosis, these are certain rare disorders. Now let's talk about what are the non-malignant or benign conditions that can also cause this disease. The important ones or the common ones being the HIV infection. A long-term HIV infection which is uncontrolled can eventually involve the bone marrow as well and lead to the fibrosis. Similarly, hyperparathyroidism, long-term because it affects the bone, causes the osteosclerosis. It can also lead to the bone marrow problems. Renal osteodystrophy, either as a primary process or secondary to a chronic kidney disease, can also lead to this problem. And systemic lupus erythematosus, as we know, that lupus can involve almost all the systems of the body. So if it is present for a long period of time and it is not very well controlled with medication, then it can also eventually involve the bone marrow and lead to the fibrosis of the bone marrow. Similarly, tuberculosis, just like lupus, is also an infective disease that can cause havoc and involve almost all the parts of the body. And vitamin D deficiency, certain types of mineral deficiencies like the vitamin D deficiency, because it is important for the bones and bone marrow development, it can lead to this process. And eventually certain rare chemicals like the thorium dioxide exposure over a long period of time, and certain rare disorders like the gray platelet syndrome. You don't need to know the details of these disorders, just for these are there for the matter of completion. So the important ones to keep in mind here are, among the malignancies, the various types of leukemias, AML, CML, the Hodgkin's lymphoma, the certain types of myelodysplastic syndrome, certain metastatic carcinomas, and among the non-malignant or the benign conditions, HIV, lupus, tuberculosis, hyperparathyroidism, and vitamin D deficiency. These are the common ones that can cause the bone marrow abnormalities.